guys, I'm just gonna do another quick video. I did a previous one about how the numbers were getting skewed and people were still confused, so let me show you again. I'm picking the news from today, so you can go back to today. I just picked their live stream and then pulled it all the way back to wherever it is right now.
In New York, the death toll is rising.
Out here in the streets, it's nothing but ambulance sirens.
But there is growing hope that the curve is flattening. Hospitalizations seem to have leveled off.
When you look at the 3-day averaging of these numbers, the 3-day average is down, which is good news.
New York had its biggest one-day spike in deaths. 731 people lost in 24 hours.
Now that's tragic, folks. Don't get me wrong. If that many people died from COVID-19, that's an extremely deadly virus.
That's one about every 2 minutes. The mayor here acknowledges the count could be higher if those who died in their homes had been tested.
It's right to assume the vast majority are coronavirus related, and that makes it even more.
No, it's not. It's never right to assume when you're talking about a deadly virus or a pathogen that's being transferred through the community. It's not right to assume. You need actual science, and Fauci preaches those over and over and over. Isolate, identify. Blasio needs to pay attention.
More sober, the sense of how many people we are losing.
Authorities are urging people not to do this and have doubled the fine for not social distancing.
If you're afraid.
Okay, I'm sure you guys just saw what I saw. They were at least 6-7 feet apart. They were exercising in an open air environment. So they're talking about fining people for doing something like that. That's completely ridiculous.
Afraid of catching something, to stay home.
Look at the front of this guy's mask. You see how dirty this is? This guy's been wearing this everywhere. And those little masks are designed to be like used in a potentially contaminated environment, discarded, not go from environment to environment to environment or worn around all day. I mean, this guy's standing outside. If you're not within 6 feet of somebody, you don't need to be wearing a mask. If you're not in that kind of a situation, they've said that over and over on the presidential briefings, but you don't see the news pumping that out at you. So if you're not in that van behind this guy on the image, if you're not in a subway in New York, if you're not on a bus somewhere, if you're not in a car with somebody else, if you're not in a store where you might not be able to stay outside that 6-foot area, then yeah, you don't need a mask. It's not airborne. It's not floating through the air, folks. It's not an aerosol. And people that are suggesting that it's airborne are extremely confused on how that works. But we're going to keep going real quick.
But Francisco Martinez says he can't afford to stay home. He's an essential worker who was...
Oh yeah, awesome. He's an essential worker. I don't even want to know what this guy's about to do for a living. Please don't deliver stuff to other people because... I mean, look at, he's got his bike, he's got his gloves on, so anything he's touching and putting in that bag, he's touching with those gloves, which have touched everything else that he has touched all day long. So this guy is literally running around on the screen in front of you, transmitting the virus if he has it.
Deliveries to make.
We're all still trying, because we don't want to stay
Reaching in his pocket for money or whatever else.
home and just not make no money. We have to make money either way because we got to survive.
According to the NYPD, more than 7,000 officers were out sick Tuesday. That's nearly 20% of the largest police force in the nation. 2,000 cops have tested positive. Officials say a police communication technician died from the virus Tuesday, bringing the NYPD's death toll to 14. Dr. Nicholas Hernandez got sick too, but he recovered and is back at work.
I tried my best to do everything I could to...
Again, this guy's a doctor. He should know. Why is he walking around in a parking lot with a mask on? I mean, that's obviously, it's the same as a soundbite, folks. Come on, pay attention.
Maintain my distance. But it's still that worry. Am I going to make it through this? Are my symptoms going to get better? Why am I not getting better? It's day 10, it's day 11, it's day 12.
Now, reinforcements are on the way, including these soldiers from the 44th Medical Brigade at Fort Bragg in North Carolina.
I used to live right there.
Their mission to provide critical support to doctors at New York's temporary field hospital at the sprawling Javits Convention Center.
We get called upon to deploy, go overseas, and do missions, but to be called upon to help fellow Americans, I think is is really a great thing.
Joining us now is Dr. Deborah Burks, the Coronavirus Response Coordinator for the White House. Dr. Burks, good morning. Thanks for being with us.
Good morning.
Well, even though, as we have mentioned, New York and the nation recorded its single largest day in terms of fatalities, there is, in fact, hope on the horizon and a suggestion that perhaps social distancing is having an effect. Can you explain that?
Yeah, we're really proud of the American people. It looks like across the United States, people are following the guidelines, decreasing their social interactions, staying 6 feet apart, washing their hands scrupulously, using hand sanitizer, and critically not going to gatherings more than 10 people. And I think the American people should be proud of the work that they're doing.
And how do you think it's affecting the curve? I mean, do you see the beginnings of a flattening of the curve, or are we frankly not there yet?
So each of these epidemics are sub-epidemics. So
I was going to stop it and answer before she could answer. You're going to see a bunch of little curves, folks, because when you take the big curve and you attempt to flatten it, you don't just flatten it. You don't get to plateau it off. That's not how it works. Look up Farr's law of epidemics. Okay, when you flatten the curve, you stretch it out. You create a ripple effect. So it's going to go away, it's going to come back, it's going to go away, it's going to come back until it finally tapers off, based mostly on environmental conditions.
You know, the New York metro area is different than the LA and Seattle area and Washington area. So Detroit, we're watching each of these, Chicago, each of them watching very carefully for where they are on their curve. And of course, New York and New Jersey, we know Washington and California started very early, went to social distancing very early. Their curves look like they are persistently flat, and that's very encouraging for us. Obviously, New York and New Jersey had what we call a logarithmic rise in the number of new cases, but we're seeing that stabilizing, and that gives us great encouragement. We know that we're seeing still the high levels of mortality that people succumbing to this illness this week and potentially into early next week, particularly in the New York, New Jersey area. But that reflects individuals that were infected more than 2 to 3 weeks ago, even before some of the strict mitigation started.
Some models, or at least one, now predicts a number of fatalities that's much lower than that original.
Okay, here you go. They're about to talk about the IHME model that everybody was blasting on the news. Potentially, 250,000, 400,000 at one point, I think it was. I'm not sure. I know it was at least 250,000 people in the United States were going to die from this. Potentially, I think it was. At one point, they had it at 400,000 to begin with. But when I did the math, I charted this, and it's on my Facebook page. I'm going to do a video on it. I blasted IHME modeling because they were almost 400% off on their models from my math to their math, and we had the same sources. So, and I'm watching this with you as if we were watching it live together, folks. So please forgive me. This is kind of my reaction to what's about to happen because I know what they're about to say.
Number, I think you said right here on our air a couple of weeks ago that there could be 100 to 240,000 American deaths. Now some of the models that have better data, presumably, now that we have U.S. numbers, are predicting the number could be lower. Do you expect that? Do you anticipate that we might come in under that initial projection of 100,000 to 240,000 deaths?
We're very hopeful because of the seriousness of what the American people have taken these guidelines. What's really important is that people don't turn these early signs of hope into releasing from the 30 days to stop the spread. It's really critical, and you can see the delay. So if people start going out again and socially interacting, we could see a very acute second wave very early. So we are really encouraging every American to continue to follow the guidelines for these 30 days.
That really raises the question whether 30 days will be enough. If 30 days of social distancing will be sufficient to flatten the curve. I believe that one of the models I just mentioned that was optimistic does assume that the social distancing practices go until June. Do you anticipate that?
I think we're looking at data every single day, and it really, obviously we're United States, but each of the metro areas have a different curve. And so we're really looking to see which metro areas have really flattened their curve or coming down the other side and really progressing well with the social distancing. And then really learning from California and Washington State about how different releases could occur by geographic areas. So all of this data is coming together, and as you just said, data is critical. Models are models, but really understanding what happens in the United States is key.
Unfortunately, one of those trends suggests that the African American community in particular has been very hard hit by this virus.
Okay, not because it targets the African American community, simply because generally across the United States, the African American community is in a more impoverished state when it comes to medical health care and preventative health care maintenance than other communities per capita. I don't know how else to say it. And it sucks. It's shit. I don't think it's fair. Oops, sorry. I don't think I'm supposed to say that, but it sucks. It's not cool.
Why do you think that is, and is there anything that can be done about it at this point?
You know, we've been very concerned when we saw where the virus was going and the clear evidence from other countries that pre-existing conditions, particularly diabetes, hypertension, obesity, and asthma, were particularly difficult in the disease course once infected. So I just want to make it clear, we don't think African Americans are more susceptible to getting infected, but we do think with those number of pre-existing conditions. And this really brings us back to the social determinants of health. And I think once this is over, we really need to look very carefully into each of those items to really look at what it's going to take to ensure the health of all Americans.
Dr. Fauci said as recently as this weekend, just a few days ago, he said very bluntly, we were still struggling to control the virus. Is that the case? Do you still agree with that assessment?
Well, I think you can see how California and Washington have done. Those were our sentinel communities. Those were our first red alerts that this.
Okay, I'm going to fast forward, Burks, to see if we can get like a death toll somewhere. Wait,
the diabetes, the heart disease, the asthma.
Dr. Burks, I know it's early. Appreciate your time this morning. Thank you.
Thank you.
What was that other clip? Hold on.
As coronavirus tears an unforgiving path across the country, numbers show it is especially devastating to one group, African Americans.
When you look at the proportion of people who get into serious trouble and die, again, it's going to be disproportionate towards the African Americans. I do expect that.
Why is the black community getting hit so hard by this?
Well, the black community has been hit by poor health for a long time. Pre-existing conditions such as obesity, such as asthma, such as diabetes, hypertension. Now you compound it by this deadly disease. I mean, it's no surprise that we're going to get hit harder.
In Chicago, nearly 70% of virus-related fatalities are black, even though African Americans make up less than a third of the population.
Those numbers take your breath away.
In the epicenter, New York City, 59% of deaths are in Queens and the Bronx, both areas with high black and Hispanic populations.
We're working very hard on the African American community with respect to what's going on because it's not good. I don't like it.
Down south in Louisiana, African Americans, who only account for 32% of the population, make up 70% of the state's deaths.
Those hot spots are in areas of the state that have a disproportionate number of African Americans.
Okay, a lot of people out there talk about social health care lately because of this damn virus. I don't give a shit about that conversation until this conversation is addressed properly. Okay, can we just get this out of the way? We need to add better health care, and we need to make better health care available to the black communities across our country. And if this isn't a freaking eye-opener for everybody to get that through their head, I don't know what else to say.
Living there.
Not every state reports cases with a breakdown by race. The White House task force says the federal government is now collecting that data.
It will be public as soon as you get enough data to be able to make a meaningful statement.
Doctors on the front lines see those numbers play out firsthand.
You pass through door after door after door where a patient is fighting for their life on the other side, and almost every single one of them is black.
Especially.
Damn, man. All right, hold on a second. They mentioned that data. Let's get rid of that. I'm going to show you this real quick. You want any of the CDC's data? This is where you go. Type in wonder.cdc.gov. It's going to take you to their online database. They have a cool ad hoc query system, and you can break it down by all kinds of stuff. Let me just do one real quick for you. Mortality, let's see, mortality. You see they have race, so you can go through single race, mixed race, bridge race. Detailed mortality, let's click on mortality. What kind of cool stuff can we get here? You have to agree to use the database, by the way. Alright, I'm just going to do this real quick. 15 leading causes of death. Give me age adjusted. I want a 95% confidence interval with standard errors, and I want it in the percent of total deaths. We're going to call it truth. Send them our request. Their database is going to send us back our information. This is what I do, is database administration. Bang. Influenza and pneumonia, J09, J through J18. Okay, so you can see over here, any data you want, you can pull it. Here's your crude rate per 100,000. The 95% confidence level. Age adjusted rate. And then they give you where they got all that from, okay? So any data you want for them, and if you want to turn it into a cool chart, you can turn it into a chart real quick. You can see obviously diseases of the heart right here is the number one cause of death. So statistically, you would think that I don't know how I could put this. Like pneumonia and heart problems go hand in hand. If anybody that works in a hospital right now is listening to this, if you work on a cardiac unit, you know exactly what I'm talking about, because just like the doctor in the video that I posted on my channel was saying, there are doctors everywhere sitting around on cardiac units, a couple that I've spoken to, because it's a ghost town and they don't know what to do. So let me just skip back from that.
Hard in smaller communities like Albany, Georgia. In a county nearly 70% African American, it has more deaths than anywhere in the state. Terica Parks is a survivor.
So I was wrapped in a blanket. I'm laying there gasping for air, and all I'm thinking is, I don't think I'm going to make it.
People are scared. We're scared. We've never seen anything like this before.
Sure you have. Sure you have. As a matter of fact, you saw it in 2017, 2018, when flu season deaths topped 80,000. Again, I mentioned it earlier, 80,000 Americans died of flu complications last winter. Worst, deadliest season in more than 4 decades. Do you guys remember getting locked down in 2017, 2018 when 80,000 Americans died from the flu? I don't. Odd.
We're going to bring in our medical correspondent, Dr. John Torres. Dr. John, that was a very disturbing and upsetting report. African Americans are being hit disproportionately hard. We broke down some of the reasons why. Medically, why do you think that is?
So, Hoda, you're exactly right. It is very disturbing to hear these, and it's people of color generally are more susceptible to diseases, and we know that they have those pre-existing conditions, the diabetes, the heart disease, the asthma, that makes them more likely to suffer consequences because of coronavirus.
I'm gonna stop this guy right here. I just want you guys to see something real quick. Sorry, I'm trying to type with one hand. We want this one. gonna skip through some of this. Ready? Because we want her. Remember earlier I said I saw that outfit? We want Burks. Wait a second. Where's Burks at?
So hopefully you can see from those numbers that we've taken a data detailed approach, really bringing the power of granular data to the supply chain and moving supplies based on really what you would call burden of disease and need. If I could just start out by not just going to the numbers at the beginning, but really talking to the
Nah, I want to hear the numbers.
per thousand, Louisiana 3 per thousand, Massachusetts 2 per thousand, Connecticut 2 per thousand, Michigan 1.5 per thousand, the District of Columbia and the Baltimore area now 1.5 per thousand, and we're watching them very closely. Pennsylvania 1 per thousand, but we're concerned about Philadelphia. What is allowing us to move supplies based on burden of disease and need is the extraordinary.
Yeah, I get it.
A much flatter curve. So you saw it stabilize down, but we see across the country 1,000, sometimes 2, 3, and 4.
Where is the go? Here we go.
Do you want to speak to that?
Yeah,
Americans are understanding more and more that
ventilator issue with 8,400 of them in the stockpile and tens of thousands more coming. Why are states like California and Washington needing to send ventilators to other states, and is that smart if they might need them later on?
Well, I'm going to let Dr. Burke speak about what's happening in California and Washington, because it is a real credit to the people of both states and the leadership of both states.
I don't want Washington.
Future of this virus in their communities, which is really astounding. The power it's in other communities to really understand solution in a transparent and amazing way. And I think this kind of education and dialogue is always critical when you want communities. I think when I first started here 5 weeks ago,
She's going to take another question.
Is what the turnaround time is for testing, and we continue to work that. And these Abbott laboratory devices.
Yes. We need to talk about Abbott.
Just one for Dr. Fauci or Dr. Burks.
Here you go.
Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
How they're characterized.
So
Bang.
I think.
Hold on a second. Standards for how they're characterized. She's talking about this. Right here. The email that went out to the state statistical staff. Sent them this, telling them how to list the cause of death. I mean, who cares if there was acute respiratory distress syndrome brought on by pneumonia? That was definitely caused by COVID-19. Again, here's confirmed with a test, folks. With a test. That's confirmed or presumed. If you look at my last video, that's not what it says. Okay? That is not what it says on my last video. Look at my last video.
I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
Okay. If someone dies with COVID-19, we are counting that. No. You're not. You're letting the media and you yourselves are standing up here reporting false numbers. You're not reporting confirmed deaths, and these are presumed, right? Add these up. Does this equal 10,000, folks? We surpassed 10,000, right? No, it's 3,307. Presumed. So where is this huge number coming from? It's coming from these. The U07.2 codes, where a laboratory confirmation was inconclusive or not available, and a clinical or epidemiological diagnosis was made. A guess. A guess. And because laboratory tests are not typically reported, they weren't going to include these. So where are all these numbers coming from? Where are the deaths coming from? They're not on the death certificates, because that's what this is based off of. So I'm just going to go back to my own Facebook page here for a second real quick and scroll down a little bit past that. That was my other video. If you guys haven't seen this, look for that. Yeah, I've been tearing her up. Oh man, R.I.P. Charlotte Figge. If you guys don't know who she is, Google the name, Charlotte Figge. If you look down here again, this is the video I was talking about. Let's see, here we go. Let me just pull this up real quick. I'm going to finish off with this. So when you look at this data and you see death from all causes drop off at such a crazy rate, I mean, there's a huge difference here. And these should level out. I mean, these should come up and up and up, and hopefully until they get into the 80s and 90s, because I would expect them to know how many deaths to expect. I mean, they know their percentage. This is the CDC we're talking about. This is vital statistics. So you would think they would know this. And I mean, all pneumonia deaths, thousands of pneumonia deaths a week just suddenly disappeared. Thousands of per week. I mean, here's the deaths with pneumonia and stuff. If you add those back in, you know, the number starts to come up, but all of a sudden, exactly. If they're talking about people dying from pneumonia and COVID, and it should be classified, well, they are being counted. It's right here. 1,410 of them. Here's the pneumonia code. I showed you on the other page. Here's the COVID code. Doesn't make any sense. It doesn't make any sense whatsoever, because when you look at the guidance page, where is it? Here we go. NCHS isn't using those. They're not planning on implementing 7.2 for mortality statistics. Down here it says, should be reported on the death certificate for all decedents where the disease is caused or is assumed to have caused or contributed to the death. They should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. If the decedent had other chronic conditions such as COPD or asthma that may have also contributed, these conditions can be reported in Part 2. See attached guidance. I've already showed it to you. But here it is, folks. If you look at the weeks, because again, remember, these are weeks. So here you have the 24th. I wish I had a slightly better picture for you.